Greetings from ICMR National Institute of Epidemiology. I am Dr. Manoj Murekar, Scientist G and Director of this institute. We recently completed a study on sudden deaths among young adults in India. In this presentation, I am going to highlight why did we do this study, what did we do, and what are the implications of the study findings. In the aftermath of COVID-19 pandemic, there were news reports on apparently healthy young individuals dying all of a sudden from unknown medical reasons. These reports also mentioned about the linkages of these deaths with COVID-19 in terms of either suffering from COVID-19 disease or vaccination for COVID-19. In order to answer the question on what could be the reasons for sudden death of young individuals, Indian Council of Medical Research did a study in collaboration with medical specialists and researchers from across 47 hospitals in India. We did a comparison of 729 young individuals of 18 to 45 years age who died all of a sudden despite being in good health with that of 2,916 apparently healthy individuals who are alive and of similar age, sex, and living in the same locality as that of the died individual. Using appropriate methods, we obtained information on any previous hospitalization for COVID-19, vaccination for COVID-19, any family history of sudden death among close relatives, any underlying medical problems, behaviors such as smoking and drinking. We did collect information on heavy alcohol drinking and vigorous intensity physical activity shortly prior to death. Among those reporting consumption of alcohol, binge drinking behavior was defined as those consuming 6 or more alcoholic drinks on a single occasion. We defined vigorous intensity physical activity as any activity that caused large increases in breathing or heart rate for at least 10 minutes continuously. We asked whether such activity was part of routine work or outside routine work in the past 1 year and 48 hours before the interview or before the death. We found that COVID-19 vaccination was not linked to unexplained sudden deaths. We concluded that family history of sudden death, past hospitalization for COVID-19, heavy drinking, or intense exercise just before death were associated with unexplained sudden deaths. Let us now see what are the takeaways from this study. Firstly, we need not worry about the linkages of COVID-19 vaccination with that of sudden deaths among young adults. Individuals may seek medical advice if they were hospitalized for COVID-19 in the past and if they had family history of sudden death. It is advisable not to engage in unaccustomed strenuous exercise or activities without medical advice. Finally, do not engage in drinking excessive alcohol, especially in short period of time. For more details, please go through our research publication in the Indian Journal of Medical Research. Many thanks for your kind attention.